Hi everybody, today we're going to do a pregnancy massage. How pregnant are you, Nadine?
We're 34 weeks right now.
5 weeks to go, right? Oh yes, that's good. And I have the delight to teach her mom, Wilma. Everybody,
Hi.
look at the camera, thank you. So we're just going to get Nadine organized. I'll show you everything that we're going to do. And we're going to put you first face up. How comfortable are you face up for a little bit?
Back's okay for us.
Back's okay. Okay, great. So we can slide this off. And for doing the massage, Wilma, at
Yep.
this time of year,
Yes.
bikinis are great. You can go anywhere and not get arrested and not have to, drape the person up. Now we've got two kinds of oils we're using here. We're using a coconut oil, and then can you tell us about your oil?
This oil is a combination of 3 different carrier oils, basically for skincare, and it has some essential oils in it, like lavender, cottonseed oil, specifically for that as well.
Yay.
So, homemade.
Yippee. Lucky you. Great. You made it?
Yes.
Well, it's nice to have a mother on
Well,
the
it
set.
was a recipe, existing recipe.
Okay, so what we're going to do here is we're going to start with an overhanded palmar kneading, Wilma. So you just go round and round. One hand stays on the whole time and the other hops over. And I'm going to come to your side. So when you're teaching this, folks, what you want to do is be right beside them, because often people aren't as gifted as Wilma. So, and this is the other way you do it. Put your hands on mine.
Okay.
And you take them for a ride. So this baby grew, oh my God.
Yeah.
So you go round and round like this. One hand stays on,
Yeah.
like that,
Okay.
and the other hops over. Come with me, take her right. So this one is going round. Yep, baby likes it. She likes it. So when you get here, stay with me. You just hop over, like that. And you keep way around the perimeter. Now we've got Nadine in the middle of our dining room table, which is a perfect place for anybody to do this. Or flip up like picnic tables out in the park or something like that. But I'll show you how you can do one side and then you lift off
Is
and
that
I go
little
on.
Elbow or?
Okay, and then you go on. Yeah, okay, you lift off and I go on. Yep, stay off, stay off. Thank you. And then I go on. Okay, now you go on. Yep, yep, yep. Okay, you lift off and I go on. Yep. And that's a really great way to teach kids to be able to do this. Yippee. And then we've got the digestive system, all small intestine in the middle, up, kind of pushed out of the way. Then what hooks up here goes up the ascending, across the transverse, and down the descending. This is where you get problems. Things tend to block up here. How's your movement? Is it daily? Everything good? Okay, and then reinforced fingertip kneading like this. So we're going up the ascending, linger in the corner there, Wilma, then come across the transverse, linger in the corner, and then down the side, so you can start right there. Those sound effects are the dog trying to break in. Yeah, and even more tips, and a little slower. I was a little too efficient. Nice. Yeah. Can we just open the door?
Totally.
Yep. Dog coming. Keep going there, Wyatt.
Yep.
Oh, I can feel it.
Here they come. Hi, guys. Hi, everybody. Hi. Good work, you guys. Supervising. Yes. Good work. Okay.
All right.
And then sometimes I go back and just smooth that out with another stroke. It's kind of like an eraser. Oh, she likes it, doesn't she?
Look at this.
Oh, okay.
Just a
Then what
couple
I do
pieces here.
is I have the ribs here and the diaphragm. And with Nadine, we did a lot of this in the first trimester because of the nausea.
Okay.
And then I lift here. So we trace along the edge of the ribs, called the costal angle. We go right down to the false and floater ribs there. Then I slide underneath and I pull up. The pull up is the nicest. So try that. Yeah, and you just track up and under. Nice touch. Your mom has a good touch.
Oh, she's very
That
good
is
at
very good. Yeah, and then you can slide right underneath. Take your thumb with you. Yep. Great. This lift is a lot easier, Wilma, when she's like lower and on the floor.
Okay.
So we taught Sebastian and Jeremy 3 lifts. One up there. There we go. One up here, which is diaphragm level.
Yeah.
Then the other like this. Ooh, she helped me
Right,
out.
I didn't mean to help.
Is waist level. And then lower back,
Yeah.
where you get the Achies, is right there, and you squeeze underneath till you can just about reach. And because she's like over there, in the middle, it's because we're one on each side, we're both reaching for her. But ultimately, if Wilma was just doing this by herself with Nadine, she'd just push this all over to that edge of the table, and that would work really well. We try the scoop at the different levels, so it's a lifting. So you just have to really lean on the table so it doesn't affect your lower back. And you use the table as a fulcrum here. There you go.
Can I
And then
sit?
really slowly lift, because you really want her lifted up. And that's really relieving in the back there. That's good.
Yeah, I can scoop close.
It's okay.
And you can take that thumb with you. And then try and meet your fingers at the back there, so you're way under. There you go. Nice. Take your time getting out and be flat with your hand. There you go. There you go. And then you just ease up the tension there. And then try lower back. Your mom's a pro. And take that under. Nice. A little too fast on the uptake. You want to get right down there.
Yeah.
So a little lower. So when your mom gets to where I was, lower. So you want to be right down here.
Like
Right down here.
towards
Lower
the
back.
further
Right
down?
on the sacrum. Yeah.
Okay.
Even
Like right there?
further. You can't get
Yeah.
too low.
Okay.
Yeah. Okay. And then pull up.
Yeah.
There you go. That's better. That one is the most relieving.
That feels good.
Oh, he's the
Isn't that
birthing
great?
room next.
That's such a great shot. Thank you. And then we'll go around and around. And now this time we're just going light, light, light. And it's called reflex stroking. We also used a lot of this in the first trimester with Nadine's nausea.
Yeah. Okay.
And we actually kind of mesmerized the tummy and all of the achy, gonna throw up feeling.
My nerves were very confused.
And you want to confuse them. That's good. Light, light, light. Nice. And even lighter. Yeah. Perfect. Yay. Okay, and can we move on to the arms?
Of course.
Perfect. Okay, now there are some traditional strokes. We always start with a general basic stroke, and that's going to be called alfarage. It's where the French invasion happened. Take this
I was just
off.
gonna say, do we want to put something under the oil?
Yeah. Nadine's a designer, so she's got special protocols.
Do you have enough here?
Okay, here we go. And we go across, and then we're pushing up. So let your hands get ahead of you, Wilma, because you want to let your body weight lean onto your hands. Come to the front,
That's that part where I probably.
and then go around the back.
I think you might
So
have
Nadine
more.
has a mom with a great touch, but Wilma has a stiffness in her hands. And so it's really great to see how to adapt the strokes, because most moms are going to be over 40. That's moms of the moms to be, are over 40. So we've got all sorts of aches and pains in our hands. So can you describe yours?
I actually had a double fracture in the lower arm, placing the arm at 90 degrees with the bones protruding and causing scar tissue in the muscles, and it shortened the muscles. So therefore the fingers are not actually able to straighten out to do exactly
So you can see this kind of creative arrangement here with fingers is like a little arthritic. So, and when she
the
goes
further
to
back
cut,
I go, the
it goes
more
like
that
So you can
curls in.
see here,
So
why
I'll-
we'll do the same stroke, and you go like this one on top of the other. Yep, and you can get closer to the stroke. So you get a stride position there, Wilma, one leg in front of the other. Yep, and then let your body weight cup your whole hand around that top joint. And this is called the deltoid muscle. You're a little too generous. Keep it stingy right at the top. Yep, and just stay close to there. Nice. Very, very good. And what you've got happening here is these pectoralis muscles are bigger because the breasts are getting bigger. They're hooking up there too. So we're pressing back here and stretching that. So again, don't go down the bicep, tricep. Stay right at the top and just rock it around. You got it. So you can see what her hands are doing just fine, even with her adaptations and aches and pains of being, what, 50 years old?
How about 66?
And come on down. This is the complicated one. It's going to be an alternate thumb kneading. So One hand goes under the damp armpit, the other goes here, and then we go up and out, up and out. Yep. Wyatt, she got it real quick there. And you can see now most people don't get it that quick, but we're moving on down. We're gonna go all the way down. We'll get the triceps in the back there. And then come around like this, Wilma, and we'll get, by turning her arm over right here, you can then get these biceps. And these are really important, especially prenatal, because these are the arms that are going to be holding on to that little one and doing all the nursing, and they really get a workout in the next couple of months. Yeah. You know what I do too is I will lean this at a right angle, so I kind of hook it on here. Yeah, and then it loosens up the tension in that inner elbow. And even though I'm shorter than you, you can stand up. That's it. And that way you won't wear out your welcome. Your back will stay nice and strong. Doesn't that feel yummy in the arms? And this is the queen of computers, right? How many hours in your job do you spend on a computer?
Oh, 5 to 7 a day.
Yeah. So this is really important for people who are designers like Nadine. You really want to make sure they're going to design great houses and furniture for her. So come on down the back here. And same thing. And we get even pickier when we're going down the forearm. This is the age of texting and working on keyboards, and you can't ever go too slow or too firm on this. And then you can lift it up as you get near the wrist, like this, and then you're not leaning over. And pick her up, like this. You got it. And drop your shoulders. There you go.
Drop
And
my
then
shoulders.
you drop your shoulders. And then turn her over like this, Wilma.
Yeah?
And again, we've got alternate thumb kneading up and down the inner forearm. Yeah, you got it. Okay, and here comes the good stuff. Carpal tunnel syndrome is often a problem with pregnancy because everybody's holding a little bit more fluid in their body, and especially people that are working the carpals a lot. So we bend like this and spend some really focused time, little teeny strokes. And come on out the back of the hand. And this is a favorite. Corkscrew the thumb, pointing it outwardly. So just grab the whole finger, go all the way out to the tip. Yep, that's it, exactly, twist it. You got it. And then take the pointer finger, do the same thing towards the outside aspect. You've got it. Lovely. Great, strong hands. The middle finger is up for grabs. It doesn't matter which way you do it. But the next two, we change and they go towards the outside. There you go. Yeah. And is that firm enough, Nadine?
It is.
We aren't using the F word. Feedback, feedback, feedback. Like we just aren't employing it. So I'm so busy talking to you. Sorry, I forgot to check in. And have we got them all? Okay, here is the real favorite. So now we aren't going to be pushing towards the heart with our pressure of strokes. We're going to be working like this. And you might want to come right over our shoulder here, Wyatt. And get this so you can see. What I'm doing is like right here. And Nadine has retained a little bit more fluid than a month ago. And it's mostly in the end of her extremity. Like she doesn't usually have puffy hands, but she's not wearing any rings. Do any of your rings still fit?
Yes, they're tight though.
It's not an issue yet, but you can tell that something's happening here. But we can't really feel it in your whole arm, but we can really feel it here. And it go right into the palm, like this, and the base of each finger. Okay, now here comes the really neat one. It looks like there's nothing to it. It's a digital compression, and let me show you what it feels like on you, and then you'll get it. So it's like this. And also the slower you go, the better it gets, right?
Okay.
So we really work down in there. And that's always a good thing to do, everybody, is really try it out on each of the massagers, and then you'll really get the feel of it. How's that, Nadine? Are we balanced?
Yes.
Isn't it cool?
That's a really great
Your mom's a whiz kid. Great. And you could do this for a long time, but we are moving on. Okay, let's put an effleurage on that, Wilma.
Okay.
And with our effleurage, everybody, the pressure is up towards the heart. And you want that pressure up, and then on your way back, we're just gonna glide back. We're not gonna put any pressure on. And then we're gonna get rid of the hand and tuck it up there. And then we're going on down to the legs. Now why, you can shoot this like up or down or that way, or you know, whatever works. And you can just keep it.
I'll go up maybe.
Yeah. So what I do here is kind of like a mini sandwich. I put my hands in a prayer position like this. And even if you want to stand between us, whatever. Oh, and we're going to track sand right up your leg. Okay, we're just going to go up and down like this. Okay, now the trick here is going to be this hand is coming on the inside. So watch, you got it. So this is going inside, and then we're arriving like that. And then we're probably out of oil, but we're going to track whatever we've got up to the hip. And then we're going to glide back with no pressure inside and outside. You got it. Okay, let's really layer out the oil. See if we can get it all the way up there. How's that angle for you, Wyatt? It's good.
That's good, yeah.
Okay, great. Here we go. We're going up, angle around. Okay, let your hands get in front of you so you can really lean on them. Yeah. And I lean on the outside aspect of the leg. It's got a band here called the iliotibial band. Starts at the ilium, goes right down to the tibia, and it's always tight.
Okay.
That's good. And then we just glide all the way down.
Maybe we can pause
I
for
can
a
hear
sec.
the master
Let's
of the... They're just going to come down if they...
go. Well, I wonder,
Want
I
to.
just want to make sure Joe's not keeping them upstairs.
Oh no, he said he'd bring them down.
Okay.
Yeah, so we're going this way. Yeah, and right up. Okay, and then park right here. Reinforced palmar kneading. So what we're doing is we're pushing, I use kind of the heel of my hand there and my elbow into my tummy so I can really push on it. Yeah. And again, you're too generous. Stay stingy right at the head of the femur, like right at the top. It's kind of like uncorking the bottle. We'll open up the circulation to the extremity by working that first. How's she doing?
You have your left hand on top. Does it
You know,
make
it doesn't
difference?
matter. Switch
No?
it around and see
Okay.
what works. Shall we yell up and make sure those guys know they're welcome?
It's okay, he's settled now.
Yeah,
He's
he
trying to
has.
bring him back to him.
And then we can start in with the ringing here, Wilma. So we get one hand pushing and the other hand pulling, and we go back and forth. What a team. Now I have to say, Wyatt, that I honestly haven't taught Wilma before.
No,
So
she hasn't.
she's just a whiz. And we've never done the pregnancy massage, even though this is a second baby, right? We didn't know each other for the first gestation.
No, unfortunately we didn't.
But we're really big on preventing sciatica. That's our whole deal here. So Nadine, I met through postpartum sciatica, and we were happily put together through choline, and then we can get right underneath. Like say she was only wanting to stay like this, and say she's in early labor,
Yeah.
well that's no problem for us to get to those hamstrings because we can wrap way around the back. So you can really wrap around there, yep, and then take your time getting out of there. And this is the gateway that we need to loosen up so this baby has an easy time getting out of the fence here. So all these adductors here,
Yeah.
with people like Nadine who are athletes, like she runs and bikes and yoga and all this, often these get so tight that they are our focus for being able to keep them not so much softened but elastic.
Yes, yes.
And so that they'll just open up on command. But having the elastin hormone running around keeps things pretty loose on your behalf anyway. Okay, we could do that a long time because it feels so good. Here we go. Alternate thumb kneading again. Pushing the individual pressure. Now that's creative. Try this one. Up and out. You got it. Up and out.
I was doing it reverse.
That was very, very lovely. Totally backwards, but nice to look at. And then come on down to the knee itself. And this is the favorite. And you go right around the knee. So you take that stroke and you go right around. That's perfect. Yeah, that is really good. And where we're getting to is right across there.
Under the-
That is the common patellar tendon. And we got right across it. Yeah, lovely. Okay, since we're doing so good on that, let's go to the contracted iliotibial band. So we're going to go this way. So you've got your thumb, and then we're going to go transverse to that iliotibial band. Same stroke, alternate thumb kneading. And with this one, you back up in a stride position. So if you get a long shot of us there, Wyatt, you'll see our posture is like leaning forward. So you really want to get that back, like back there, so you can lean on them. And then that way you've got steady pressure. And I'll just come around and check your stroke. Keep going there. Yep. Yep. Yeah, you've got these here, which don't give you as much of a, because you've got one
stride
leg.
back.
Try
I
that
do
when
have
you
long
stride
legs.
back, then you can go right back like this. So try that.
Oh,
one.
dig your thumbs in. Yeah.
You just want to be able to get that steady pressure. Yeah, and try not to lift them up. Yay. She's so good. You're lucky. And are you here for the labor and delivery?
I'll probably be, we hope to time it so that we're going to be here. Yeah, we're
Okay.
planning to come back for sure.
Because the more massage we put into the works, you know, before the due date, after the due date, waiting for the real due date, the better. And because she's so athletic, the more we focus on getting everything loosened up here, the better. Okay, and just come right down to where it attaches at the tibia. So that iliotibial band is always going to be our focus for helping loosen this whole area up. Okay, let's go.
Is the mummy to be here making mental notes so I'll remember all this?
Oh, I've got it all. We'll play you the video, but you can just massage along with yourself. Okay, so now we have shin splint central. The tibialis anterior runs along this side of the ridge. Feel that ridge of the tibia?
Yeah.
Okay, so this muscle here
Yep.
runs all the way down into the foot. And it's this little muscle that gets tight and pulls, and then you get a shin splint, which is really stubborn. You also can get that just in pregnancy and not from overexertion. So this is going to make your offering of thumb kneading tiny. So both those thumbs stay on that side. You
Yes.
got it.
Yes.
And then they're little. Yeah. Oh, how are we doing?
So good. I've been having tons of actually cat.
Did you get that long shot? She said so good.
So good.
Okay. And the baby likes it too. Great, thanks, Mike. And if you get back or hold it up or whatever, you'll see how we can go at the same level down here, all the way down. So when you're doing a tandem massage, everybody, you want to keep the hands at the same level, and it's just so much easier on the person on the receiving end. They don't get neurologically scrambled with, like if Wilma was there and I was here.
She's trying to process it all.
And then come on down like this, Wilma. So you've got the thumbs going around those bumps. One bump is called the malleolus, all the way around. I just
Oh,
cup.
you're just cupping it.
Yeah.
Okay.
I cup it like that. And this is also a good side and aerial shot on this. Why you can see us going around. And I'm doing a little fast, you're right. It's nice when we slow down. How's our pressure? Should we put more pressure?
No, it feels great. It's been very consistent.
Okay. And then I use the heels of my hand on the heels of her foot. Yeah, so use this right there.
Yeah. Oh,
And
I
really
see. Okay, like
work
this.
it away. Yeah,
Yeah.
it's
Okay.
nice. Okay, and then let's do something fancy. So I'll raise
stand
you.
next to you here.
Okay, across the bridge, down Johnson Road, Pulpit Rock. Okay, and then you go to your side, I'll go to my side, and we do a rolling to Boatman, and we roll it up. Yep. So it's kind of that motion with it. You got it. Are we doing anything?
Oh, that's amazing.
Isn't that neat? Yahoo! Okay, we keep this up for 10 minutes.
I would love that.
There we go. Yay. And we should put that corkscrewing and thumb kneading on the feet or they'll get jealous of the hands. So we do all the thumb kneading and then we're going to corkscrew each toe. So far so good.
Christine, is there anything preventative wise to do for calf cramps? Like
Yeah, we're getting to that.
you are.
So one of them is the shin splints. The
Mhm.
other is the spasming
Yeah.
in the lower leg, and that gets to be a huge problem in the last trimester. And then the closer, because the baby's dropping,
Right.
and it squeezes, and it's really easy to set off the legs. Are you getting nocturnal cramping?
Yeah.
Okay. And we're gonna
She
go
and I,
like
she and I
this.
both.
Yeah, I get it
Get them
too. And you can get that if you can tank up on more sleep. That helps.
Is it?
And you got to up the level of the calcium, and it's warm milk and molasses and all that kind of stuff. But
Right.
the massage is still the best. So we're doing a thumb ringing here, Wyatt. You might need to get a shot kind of coming back over where I am, over my shoulder. But it's this kind of thing where we're going back and forth across there, especially this transverse arch. We're going back and forth. And then what we do is that poke and press, Wilma, like that. And especially this transverse arch, we really get that going because it flattens. It just spreads right out. And then we go down the longitudinal arch here. Same idea. Just really press with those tip of the thumbs. Like that. Yeah, good, good, good. Great. Yay. Okay. And then what we're going to do is we're actually going to milk these calf muscles from this position where she's face up.
Okay.
So we're going to hold underneath here. And I do this in a bunch of ways, like I'll lift up here because I have more power like this than I do with my hand. And then we're going to take this and we're going to scoop with huge scooping strokes up that gastrocnemius. So start right at the Achilles and lift. Nice. And lift.
Oops. I'm
Does that
taking
feel
her whole
good?
leg.
And you can control it by
Okay,
this, you know.
yes.
There you go. And lift. Yeah. How are we doing?
Feels great.
It's good, eh?
Oh yeah.
So that's a single-handed lifting that we're doing, and we're really milking that muscle, which is a really great idea. She's so good. I'm so lucky. Okay,
I
and
haven't
then,
done this before. Really.
and then we're going
I
to do
haven't.
both, but you have a feel for your daughter. And then we're going to go like this and lift. So we're going to take it. Now there's a groove in this muscle. It's like a bivalve groove, and we're going to go with our fingertips like this. So starting at the Achilles, we're going to groove in there and lift right to the back of the knee, and then drop it and glide back. And then we groove in there again. Is that too much grooving?
No, you could even do more
Yeah.
pressure as far as that.
Okay, good. And just the weight of the leg into your fingertips
Yeah.
is good. So let's go slower. And that should work. Really get your biceps going, eh? To lift like this. Oh, jeez. And come on back. And then I do a grasping back and forth. Just a whole bunch of work on this calf muscle. So the more we can work the calf muscle, first with the milking, single-handed, double-handed, and then we can also do our ringing back and forth. And we go right across that tibialis anterior too. But we've got the back of the hand scooping and the front. So we're pushing and pulling. So you asked the right question, Dean, because the leg cramping, the nocturnal leg cramping is just so painful for people.
Yeah, it's not fun.
And the foot starts to cramp then, and it's really very
is it
hard.
a buildup of lactic acid?
It is, but it's a lot of baby pressure, you know. It is a buildup of lactic acid when it's been the first day of skiing and, you know, that kind of thing. But and then I go back to doing picky strokes. I shouldn't say back to. We go even to a more focus. So what I'm doing underneath there, Wyatt, is like I'm getting my fingers up underneath, like up underneath there. So you can see it's like this kind of groove. And I'm just fingertip kneading up underneath there.
Okay.
We will do some in a sideline position, but you can really get this going. And I mean, you could as easily lift it up like that and groove up and just invent strokes on the spot. The idea being upward, pressure's always up. And I didn't tell you why, but the veins have these little valves and they want to open that way to the heart.
Okay.
They don't like being pushed the other way. That's called varicosities, so we're just going up And that's about the only contraindication that we have for this, is if Nadine was exhibiting any problems with her peripheral circulation, like varicosities. If you had had that in your family history, or Nadine's dad, then we would be on the alert for not being able to go as deep. And in those cases, then I use tons of hydrotherapy when I can't use pressure. Okay, and then let's go back to our beginning, just milking it. So we'll just smooth out all those picky things we were doing. But yeah, we can keep a real focus on your legs for the next 5 weeks, you know, and really see what we can do. Just the way we focused in the first trimester on your nausea, and see what we can do. Because we can get everyone on the team, like I'll teach Slaney and Sarah how to focus on this, so it'll make a big difference. Guaranteed. Good work, team.
Excellent work, team.
So now what we're going to do is turn our willing victim onto her side. So Nadine, which side would you like to go first? Okay. And then what I'm going to do, I'll show you here. Work turning's all part of it, so keep camera rolling. Gotcha. We okay now?
Yep.
Great. So what we're going to do now is we're going to teach you about 2 kinds of line. One is full crooked, and as opposed to crooked. But these go together like that, and then we put a pillow in between. Okay, so that's the one that everyone thinks is great. And what you do here is have this up. The whole thing is so this has a level and not lower. If it's lower like this, then what you start getting is a twist in the lower back.
Yeah.
So what I like is with the lower leg straight, Nadine, and then the upper leg is crooked. And that is one that people don't think about quite as much. And the idea being that we would lift right to the end. I'm just going to scoot this a bit more. Yep, and then take the whole thing up. Great. How's that for baby?
Great.
Great.
Can I grab one more pillow here?
We're getting there. Yep.
Heartburn.
Okay, so then up here, I tend to use more than one pillow. I tend to use a pillow as a speed bump because we're going to be pushing on that side of her. I don't want her to get squishy. So we're going to put this also underneath there. Okay, you got it. So right there and in the front. And that goes between her breasts, and that way we can't get her to go in the wrong direction. Now, with this, when you've got a tandem thing happening, we can actually do different parts at the same time. Okay. We could do the back massage and the leg, then we can switch for the next set too. So I'll show you here. For the leg, what I'm going to do again is start off with that fancy stroke. Here comes the quiz. What do you call the first stroke, Wilma? It's a fancy word. It starts with an E. And it's different. You got it! Yeah, your daughter.
Should get bonus points for saying it with the right accent.
Yeah. Okay, so I push up and I go like this and I go, and again, I'm going to emphasize the hip first, right?
Okay. Yeah.
And I'm going to be doing reinforced palmar, overhanded palmar like we did on the tummy, alternate thumb kneading to the head of the femur. Then I'm going to take it all the way down the iliotibial band right to the tibia, and then I'm going to push back up. Or I could alternate thumb kneading back up. What I cheated on was not doing the ringing first. And the ringing is really good before you do picky strokes and then after, just to erase it. And it's always a favorite. Again, the knee, we can really emphasize even in this crooked position with the knee bent. And then we're going to get right down here. So I'm going to go ring, ring, ring all the way down. And then I'm going to groove up. And I can pull, and I've got this groove thing happening in there, and that takes care of all this sort of stuff. And then into the ankle. So it's all the same strokes, just adapted to sideline, right? Okay, but here's the exciting stuff for the back massage. We're going to start, I'm just going to undo all the wonderful decorating here. And ding, 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 ding. And I think we're just going to loosen it so we can just do it back up again. Okay, so what we're doing is we have here the lower back. This sacrum is like this.
Yeah.
And this is where we put the counter pressure when a contraction's coming. We just push, 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 and the pressure on the inside and this tend to equalize each other, and it's much more tolerable. So we'll be able to do that for you this when coming on. Last time was a delivery. Can you describe it, Nadine?
Well, it was, I didn't labor at all. It was a cesarean.
And it was planned, right?
It was, yes.
Okay, so you knew what was happening. And with this one, what are we planning for?
We're going to attempt a vaginal birth after cesarean
Yippity-doo.
at the hospital.
Great. So all on the first, like every 10-minute contraction type of thing. When the 10-minute contraction comes on, I'll do one and then I'll let you practice, okay? So we got a contraction coming on and nice deep breath, Nadine. And I don't press everything I've got. I just keep steady pressure. Yep. And it's a quickie. It's coming up the hill and nice deep breath. Just let everything drop down. And now I'm pushing for all I'm worth. And that's when it's got its peak of pull and contraction. And now, nice deep breathing. Good work. Good, 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 good. Coming down the other side. I stay steady. So I just keep on it. Steady pressure. And last deep breath. Yeah. And then do an extra breath, even though everything's gone now. Just let everything drop down. Good work, Nadine. And then I just lighten up. And then what I'll do is a light reflex stroking. And it's like an eraser.
Yeah.
Okay? So then what you do is the same thing. Just talk her through it. Okay, put one hand on top of the other and she'll tell you when you're right on it. And do that same backup thing that I was doing.
Okay. Now, with these fingers not being able to straighten.
Just put one on top of the
One on
other
top of the
because it's more the heel of your hand that has the real
And the
business to
heel
do.
sits on the sacrum,
Right on the sacrum, yeah.
Okay.
And she'll tell you if it's the same as mine. How's that, Nadine? Is she
Go
right
like
on
an
it?
inch lower, Mum.
Inch lower. And it's interesting the way they'll know, just like that.
Lower this
Yeah.
way?
Yeah.
Okay.
And when it's coming on, you can say, I'm in the right place. They'll say right away. A little bit lower, a little bit higher. No.
Okay.
Okay.
That's perfect.
Okay, and away you go. So just coach her verbally.
Okay. So take a deep breath. Take a deep breath. So how long should I wait before I apply more pressure?
You keep going. Steady, steady. It's getting stronger and stronger. And you always tell her she's doing a good job. Right from the very beginning. Hey, Sebastian.
And she is going to do it.
Yep. And you can really extend your arms and really be pushing it. Because now you've got the height of the contraction. Deep, deep breath. Focus, focus, focus. Yeah, give that a good squeeze, Nadine. There you go. Coming down the other side. And stay steady right till the end. And we've got our last breath. Nice work. And then what do we do at the end? Quiz time? Yeah, light reflex stroking. And why would you do that, Wilma?
To erase.
Yeah, you got it. Yep. Hey, Sebastian.
Hi, sweetie. You want to come here?
We're massaging your baby sister. And you can help us anytime. You know how I taught you? I'm teaching your grandmother. So what we're going to do here, Wilma, is we're going to go top to bottom. So we're going to start our effleurage here. And these long muscles, the erector spine, I start here. They run parallel to the spine, right up to here.
Yep.
So we're going down, and again, effleurage, light up the sides. And you can do that 3 times, and then I'll get in your way here. And then we're going up, like that. And both ways feel really good. Feels really good pushing down onto the sacrum, and it feels really good starting at the sacrum. So you try coming down.
Hang on, so the spine is here and it's
Spine's
on
in the
either
middle,
side, right?
either side, yeah. And just let the whole hand, you got it. Yeah, very nice. You got nice long arms, that's great, and way out. This time you can really get a grip on the backstroke. Nice work. I'll go up here. You can dip down the middle as I'm going down the side. Nice work. How's our pressure, Nadine? Great. Okay, then you come around here and let's start ringing her. So if we ring, you can ring the top. Okay, you can have the bottom. I'll ring the top. Yeah, and do bilateral both sides. And this is where you bring your wrist as low as you can to the table. You got it. And then push it away. And then pull it back to you. And then what we'll do is top, let's do top end, and it's a good fit. So you can stay right up here. So don't forget about the bottom.
Okay.
We'll just do top. There we go. Yep, there we go.
Mom. Hi, honey.
Hey Sebastian, do you want to do tummies with us? No. What's your baby sister called again? Do we have a name? Francis. We're gonna do Francis. Is that okay?
Frankie.
We call her Frankie for short. Okay, and let's do alternate thumb kneading. So with this one, what you can see where we're gonna work is all around the shoulder blade, like that. And then what you can do is all in the lower back, like that. And then we'll switch places. Yep, you got it. Great. How's our pressure?
Good.
Okay, and then we can slow it down. Okay, and you can come on up. And I'll go down. Nice work. We can take this show on the road. This is great. Yeah. Okie dokie.
Be a guest speaker at prenatal classes.
You got it now.
Yeah.
You're experienced. And then I do it this way too. So I can go across the fibers, or I can keep both thumbs on one side. That's right. Yeah. Very nice. Yep. Very good. Yay. Yeah, and try and keep both thumbs on one side of the spine at a time.
Oh,
it's
one
more
side.
focused. Yeah, there you go. Yeah. Nice. Good, good, good. Great. Okay, and let's effleurage to... Okay, you got one coming down. There we go. Yippee. And then we can do some light reflex stroking. You pull up, I'll pull down. Great. And then what you would do, folks, just to, balance everything perfectly, you would get the other side done so that we would, have Nadine flip over to her other side, and we'll do that as our finishing touch. But I really want to show you how you can finish with the face and scalp.
Okay.
And we'll turn you onto your back again, face up. And Jer, can we get you in on just the last stroke here?
Of course.
And you never know, your assistant might want to join us. And Sebastian, if you want to join in, I'll show you where the stool is, right here.
Hi, sweetie.
You can get on the stool, or would you like this chair instead?
No.
Okay, well, you decide which
You
one.
want to come sit up here with me on the table?
No.
So if you want to join us, Sebastian, it's this chair right here. Okay, so here we go. Did I ditch the coconut oil over there?
Yeah, you put it here.
I think
Thank
we
you.
moved it over here, yeah.
Okay, so what we'll do, we'll take this one, give you back that one, take that out of here. Great. Okay. Sebastian, do you remember how we did the tummy? I'm going to teach your grandma, but your dad's going to come in. That way we've got all set of hands on. And this is Jeremy and Sebastian, the men in the house. And Sebastian is the boy wonder with massaging the tummy. You come up close there.
Okay.
And Jerry, are you okay losing
Yeah.
your watch and doing some tummy stuff? Good, good, good. We'll have everybody on. You want your own?
Oh yeah.
Okay.
I was going to say this is going to be one good...
It's the family rub this time, everybody. So we've got, so Jeremy and I always compete for the Monday massage night. He thinks he invented it. So I'd like to introduce the full family. We have Jeremy, Dad. We have Wilma, Omi, Mom. And we have Nadine, Mother, to be again. And what we're going to do is run the quiz for the day. We're going to do our overhanded palmar kneading. And you can take in there, Jer. Great. And then you can take in there, Wilma. Yippee. Great. And then we have our reinforced fingertip kneading. What's this good for? Does anyone remember?
Expanding the ribcage.
Hey, that would work. I don't have
Bowels.
that answer.
For the bowels.
It's digestive, yeah. Okay. And Jeremy remembers we had our respiratory lesson, which I totally forgot. Okay, so Jarrett, we can teach her. So we're going on and off the ribs here. all along that costal angle. And what that helps is with the diaphragmatic attachment there, it eases up her breathing. And she was having real trouble with the nausea and breathing. And then we did that groove like he's doing, like we went right under here, like this. How's that?
Yeah, that's good.
And then here's the fancy one. We went like this, thumb up like that. And then we grooved our fingers down there. Okay, so to start with, if you go along with Jer and do this reinforced fingertip kneading, what you're doing is hopping on and off the angle of the ribs. And the diaphragm attachment of muscle underneath there gets eased up. Yeah. Careful not to go down as much as kind of a side slide. Yeah, because you've got these pokey uppy ribs happening there. Okay, and then try the groove thing. So if you guys both start at the xiphoid process there, and then we're just gonna work right along. Yeah, and it's more an up and under. There you go. Yeah, and I put another reassuring hand on them. Yeah, right, there you go, perfect. Yay, good work. Okay, and then remember we did the rib breaking. So then you get a groove like this, and you can reach for the far side, and you pull up, and you get the groove like he's running right in between the ribs. So then you can lean to that side, and you lean way from the back of her and pull up. And this is common to palliative or pregnancy. Either way.
Far up, do you think?
No, it's
Yeah?
good.
Just
And
the
you can do
side?
both. Remember how we did both sides
Yeah,
down below?
yeah,
You
we
can do
did.
both right there too. Try it.
Want to find your farm downstairs?
You're so good. That's great.
You don't see a farm? Yes, find your farm.
See you, Sebastian. Bye. That's great. And right here. Your mom goes for your favorites.
Yeah.
Very nice. Yay.
Yeah, hits.
And that kind of thing is probably going to be the all-time favorite, going underneath there and really easing up the back. Okay, so just a quickie. This is the way we do the face, always pulling upward from the angles here, and then this. So that's always my great finale, is working right there. So I'll let you get right in. I let my arms rest on the pillow, and I drag up there, and then I just work right in that groove. Yep. And often when babies are symbiotically eating up our calcium, this is where you really feel an achiness in the jaw and the teeth sometimes.
Okay.
And often that's just a sign of calcium deficiency. But it's amazing how much this will help ease up things like sinus headaches, because people are carrying more fluid than usual all over their body. So often everything feels a little tight there. Yep. So just easing everything up in the face is great. And then coming to the temples. And right on the hairline where there's a tissue change from skin to scalp, it's more sensitive. That's exactly it, Wilma. You can be right on your tips. And I think she can be a little bit firmer, right?
A little firmer, yeah.
Yeah. Nice. Yay. And you could do that for about an hour. But I'm cheating. And I'm going to move us on. So you get a claw-like grip like this and work right into the scalp. Like that. So you really move, instead of going back and forth, you hook onto the skin and you move the underlying muscles and then move to a new spot. Hook on, move the underlying muscles, move to a new spot. So try that. So it's a great big claw-like grip. Really press with your tips. That was good, wasn't it? You can't tell the difference between mine and your mom. Oh my goodness. And you can even be more tips. That's great. Sebastian, can you help me supervise for a minute? Bring the truck, okay? Hold on to it. Hold on. Can I take the truck? Can I take this thing?
Maybe if we park a digger on top of your tummy, maybe he'll come.
Do you want to bring it over here? Okay.
You want to have the digger here too, sweetie?
Bob the Builder was what I'm always there. There you go. That's great. Yay. And then once you've done a half hour of that, you do this kind of thing and you just lightly stroke through. Great. And then you ask for favorites. And that's usually the finishing touch.
That's nice. Say all of it. Do it. Start,
Yeah, right.
start from the beginning. Do it all.
I start the massage all over again.
Yeah. Good angle there.
Just
from
like in the old
Nadine's
days, my mother
face.
used to brush my hair when it was long. I could just sit there for hours.
I know, that is such a nice ritual. And it's the same sort of thing. That's what's neat about Nadine's partner Jeremy having a weekly idea of a massage. I mean, it just sets a family value. That's really important for tactility, domestic success. And then the back of the hand is really, really soft. There we go. Okay, you do that on each side, and I'll do that on Francis. And they'll get the same touch. That's great. Well, thanks, Nadine. That really helps lots of people learn.
Thank you.
And thank you, Wilma. We did a good job.
Oh,
Yes.
you're welcome.
Yay.
It was my pleasure.
Great.
Never too old to learn new skills, right?
Oh, that was good.
Absolutely.
Good family you inherited here, Jeremy.
It's a good one, eh?
Yay. So it's good if you do rest, and then if we just have another sheet to cover up, this might be dry.
I can just shimmy out. The sunshine's almost touching me, but I know.
That's okay.
Oh, that's the dog towel. It's not photo.
The dog towel isn't going to work.
I mean, I don't mind it. It's just
The
not
dog
pretty to
towel
look
is
at.
now going on. Where did those dogs go? Where did the dogs go, Sebastian?
Hey.
Oh, there. That is definitely the kind of music you want to have. Yes.
Wow. Some big sirens.
So Sebastian, what about doing another massage with your baby sister? Do you want to do that next week or the week after? Okay, it's a deal.
It's a deal.
It's
Done
a deal.
deal.
Done deal.
Yeah.
Okay, so you will see the next installation of Sebastian and Francis. Yay, hands on. You guys got class and the right vehicle.